So after we do our observations and our palpations, the next stage in the evaluation process is range of motion. So remember, we always want to start with the patient doing active range of motion, progressing to passive range of motion, and then ending with resistive. So I will first show the active range of motion with Cole demonstrating it, and then I will also measure it using the goniometer, followed by myself providing passive resistance and then resistive resistance. So for Cole, for cervical spine, you want to measure cervical flexion, so that would be chin to chest. Can you do that for me? Good. Then chin up towards the sky as far as you can go. That's cervical extension. Cervical rotation, I want the patient to look over their left shoulder. Good. And now look over the right. Good. And then lastly is cervical lateral flexion, so ear to shoulder on the left side. Good. And then ear to shoulder on the right side. Good. So that is for active range of motion, and I will demonstrate how to measure that. So remember, think back to the lecture video, this circle right in the middle here, this is the fulcrum or the axis. The arm with all of the numbers is going to be our moving arm, and then the arm with just the straight line is our stationary arm. So when I want to measure cervical flexion and extension, I'm going to have the fulcrum right at the patient's ear. I can have the stationary arm either straight down or I can have it up towards the sky. Either one is technically correct. I'm a little bit more comfortable with it just straight down. And then I'm going to line up the moving arm with the tip of the patient's nose. So now I'm going to ask him to bring his chin towards his chest. And the moving arm is just going to follow his nose. Good. And then you would take the measurement right in here, and we'll practice that during lab. So he's going to go back into neutral, and then again the fulcrum is just going right into the ear. The stationary arm is just going to be straight down, and then the moving arm is going to be following the tip of the nose. And I'm going to ask the patient to look up towards the sky as high as he can go. Good, and relax. And then again, you would just note this number and the change in the range of motion. For cervical rotation, I'm going to stand behind the patient. I'm going to have the fulcrum at the top of the patient's head. I like to keep the stationary arm back towards me. You could also have it straight out in front. The moving arm is going to follow the tip of the patient's nose, so I'm going to ask him to look towards his left shoulder. Good, and then towards the center. And then remember, you always want to measure bilaterally, and then look over your right. Good. And just measuring the top of the patient's nose, and you would note the change in the range of motion at that point. Lastly, for lateral cervical flexion, I'm going to have the patient rotate all the way around. Good. The fulcrum is going to rest on C7, so if I'm having a hard time finding it, I'll ask the patient to drop his chin towards his chest. Good, and I'm just finding that protuberance that sticks out. Go ahead and relax. I'm going to have the stationary arm just pointing straight down, parallel to the spinous processes, and then the moving arm is going to follow the occiput. So I'm going to ask the patient to bring his ear to his shoulder, whichever way is fine. Good, and then relax. You would note that change, and then same thing on the other side. Good, and then again, I'm just following the patient's occiput. After we've done our range of motion, the next step is to do our manual muscle test. So I'm going to have you lay completely flat with your head here. So remember, there are 3 muscle groups that we talked about. So the first one, the anterior group, will be the SCM and the scalenes. So I'm going to have the patient rotate to the opposite side. So if I wanted to assess his right sternocleidomastoid in the scalenes, I want him to turn towards his left, so look this way. And then he's going to flex his head up towards the sky. Good, and you're going to hold this position. As a clinician, I'm not going to slam his head down, I'm just going to use 2 fingers and push down. Hold for 5 seconds. 2, 3, 4, 5, good. So remember, the SCM is anterior, so you would want to facilitate neck flexion. The posterior group is going to be the semispinalis and the splenius muscles. So I'm going to have the patient lay prone, so I should lay belly. Good. And if I wanted to assess the semispinalis and the splenius muscle groups, remember that is going to be same side rotation. So here I would be assessing the patient's right side. So again, he's in same side rotation and then neck extension. Go ahead and extend up, good. And then same thing again, I'm just going to push down into the table using 2 fingers. You could also have them slightly off the edge of the table so that they're not limited by the table. Either one would be okay. Good, go ahead and relax. Remember holding for 5 seconds. Lastly, we have the upper trapezius. So it's going to be a similar body position, but remember the upper trapezius facilitates opposite side rotation. So if I wanted to assess the patient's right trapezius, I would have him turn his head to the left. Good, and then he'll go into neck extension. Perfect. And then again, I'm just going to push with 2 fingers, hold for 5 seconds. And those would be the manual muscle tests.